Good afternoon. My name is Laval Barrera, and I will be presenting my report on recommended treatment methods for college students experiencing mental health issues. I will provide a disclaimer for my presentation regarding mentions of suicide while I present. Please enjoy my report. The agenda for this presentation is to cover the following: problem definition, mental health disorders I have researched, treatment methods to help cope with these mental health disorders, the comparison between different treatment methods, our recommendations, and my summary. First, we'll start with the problem definition. I wrote this report to talk about the struggles that students face regarding to mental health. There are many unfortunate realities and outcomes that result from these battles, and one of the saddest instances is suicide. Suicide is actually the second leading cause of death among individuals from 15 to 19 years old, and a cause that can be prevented through many methods. It is an unfortunate reality that our youth faces so much cruelty and strife, and as such, many students are pushed to a point where they believe the act of suicide is the only way to escape these overwhelming pressures and the challenges that are thrown at them. A period that was especially difficult for our youth was quarantine. During the COVID-19 pandemic, many individuals, including students, faced immense isolation and countless hurdles that pushed many to their edge. Students were diagnosed with multiple mental illnesses that arose to the surface during the pandemic. Depression and COVID-19 were so severe that they fell under the disabilities category for schools due to how impactful these illnesses were. Students struggled with online learning and with isolation from other students, leading to depression and, of course, suicide. This is why it is important to research the topic of mental health with college and university students to explore youth counseling, and why it will need to be taken more seriously. Good mental health is important for students to be successful in college and post-college life. The right counseling for our younger groups can help them learn how to handle their feelings healthily and sustainably. Youth counseling provides many positive aspects for an adolescent, such as instilling discipline, learning healthier coping habits, and learning that it is important to avoid bottling up more emotions, among other positive attributes. In this section, I will be reporting over different mental health disorders. These disorders include depressive disorders, anxiety disorders, trauma and stressor-related disorders, and the autism spectrum disorders, which is now known as the autism spectrum. Depressive disorders are one of the commonly recognized categories of mental health disorders in the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM. The current edition of the DSM is called the DSM-5, and it includes a multitude of mental illnesses, but I will be discussing major depressive disorder and manic bipolar depression. Each subtype will include a definition, possible causes, and the effects it could have on a college student's life. Major depressive disorder is characterized by an individual experiencing constant feelings of sadness or lack of interest in activities. It is also referred to as clinical depression. Individuals who experience feelings of worthlessness, restlessness, irritability, fatigue, suicidal thoughts, and more may have a major depressive disorder. Factors of this mental illness are believed to either be genetic, biological, or environmental. An example of this would be the factor that GABA, a neurotransmitter, has been found to play a role in the cause of clinical depression. Individuals who experience severe stress could also develop this disorder in their adult life. Parents and genetic traits play an important role in the cause of depression as well. Bipolar disorder is characterized by an individual experiencing chronic episodes of mania or hypomania that alternate with depression. This disorder's symptoms often lead to initial misdiagnoses, and this is due to the difficulty of recognizing the symptoms and this disorder due to how its symptoms overlap with other disorders. Bipolar disorder contains two subtypes, bipolar disorder 1 and bipolar disorder 2. An individual must have at least one manic episode to meet the criteria for bipolar disorder 1. They must experience a current or past hypomanic or major depressive episode to meet the criteria for type 2. The cause of bipolar disorder is unknown, but is believed to be due to a mix of genetic, epigenetic, neurochemical, and environmental factors, according to research. Manic episodes are when an individual experiences extreme energy, happiness, or irritability that lasts for at least a week, and this could affect a student's life by interfering with their classes and coursework. Hypomanic episodes are not as extreme as manic episodes, but they are still prevalent enough to affect the college student's life. Next, we will be discussing anxiety disorders. Anxiety disorders include commonly known mental health disorders that affect young adults today. These disorders include generalized anxiety disorder and agoraphobia. Generalized anxiety disorder is a mental health disorder that is characterized by an individual experiencing fear, worry, and constant overwhelming feelings. Individuals with GAD experience excessive and unrealistic worry about common everyday situations. Generalized anxiety disorder is one of the most common anxiety disorders, affecting up to 20% of the adults each year. The criteria is an individual experiencing excessive anxiety for a minimum of 6 months, having trouble controlling the worrying, being easily fatigued, irritating feelings, and tensing muscles during these episodes. This disorder may be caused by stress, medical conditions such as diabetes, child abuse, or substance use disorder. GAD could interfere with a student's life by causing overwhelming fear about their classes. They could experience unrealistic worries about everyday occurrences that could lead to them staying indoors and affecting their attendance and their grades. Agoraphobia, a rare type of anxiety disorder, is when an individual experiences intense fears that keep them from going out into the world. Individuals avoid certain places and situations that will make them feel trapped and helpless. Agoraphobia affects less than 1% of individuals in the US. However, women are 2 to 3 times more likely to have agoraphobia than men. Due to its rarity, though, professionals do not know what causes the disorder, but they believe it may be genetic. Agoraphobia could affect a student's life drastically. Fears of college setting could lead to a drop in students' grades and academic success. Next is the autism spectrum. As I said before, the autism spectrum is the new diagnosis, but it was previously known as autistic disorder, Asperger's, and PDD-NOS. I will be discussing Asperger's syndrome and pervasive developmental disorder not otherwise specified. Asperger's syndrome is an outdated diagnosis that belongs to the autism spectrum disorder. This syndrome falls on the mild side of the autism spectrum and is called Level 1 ASD. Individuals exhibiting signs of Asperger's may have difficulty with social interactions, engage in repetitive behavior, and may focus on routines. Individuals with Asperger's do not have language or cognitive developmental delays. Individuals can manage their daily lives on their own, and this syndrome will not always prevent them from maintaining jobs and pursuing further education. Men are, however, more likely to receive a proper diagnosis of ASD than women, and the causes of that are somewhat unknown. ASD could affect a student by impeding their social life. It is not as severe as autistic disorder, but could still affect them. Pervasive developmental disorder, not otherwise specified, is also an outdated diagnosis that was used before 2013. This disorder was given to individuals who did not fit the full criteria for an autistic disorder diagnosis. Individuals with PDD-NOS have lower support needs and do not display characteristics that those with autism do. Traits of this disorder include problems with changes in routine, problems with understanding language, and problems with relating to people. Trauma and stressor-related disorders. Trauma and stressor-related disorders accumulate from indirect or direct exposure to moderate or severe traumatic events. I will be discussing PTSD and ASD. When we talk about PTSD, a lot of individuals think about veterans. Veterans experience a severe amount of trauma and stress, and this leads to PTSD. However, both disorders are close. Post-traumatic stress disorder is a well-known long-term disorder that is caused by exposure to a severely traumatic experience. Patients who have experienced military combat, sexual or physical abuse, accidents, or severe injuries could develop PTSD. This disorder affects 7 to 8% of individuals in the US. Another cause for PTSD is linked to a possible malfunctioning hippocampus. Researchers believe that people with PTSD appear to have a smaller hippocampus, but they do not know if this happens before the trauma or after. People with PTSD may experience intrusive thoughts, irritability, mood changes, nightmares, loss of interest in activities, flashbacks, and more. Acute stress disorder is a short-term trauma disorder. This develops in similar circumstances when compared to post-traumatic stress disorder, though. ASD occurs within a month of traumatic or stressful events. Individuals struggling with ASD exhibit similar signs compared to those who suffer from PTSD. ASD is a temporary disorder but can develop into PTSD. Acute stress disorder can occur for 3 days to a month and is a stress and anxiety disorder. The cause of ASD can range from death in the family to threats made to them. We will now be discussing treatment methods, and treatment methods history is based on Sigmund Freud's establishment of the concept of psychoanalysis in the 19th century. This method, however, has multiple subtypes, but I will be discussing group therapy, family therapy, and one-on-one psychotherapy or one-on-one talk therapy. Now we will discuss the different types of therapy. Psychoanalysis or psychotherapy involves a client and a professional who has training in this area. This is one of the most common forms of treatment in the psychology field and can be applied to many individuals to treat most mental health conditions. Many benefits root from this therapy type, such as forming appropriate coping mechanisms, talking an individual through a difficult or stressful situation, adjusting to sudden changes in a patient's life, and navigating through college life. Individuals who have experienced some sort of traumatic event or suffer from abusive childhoods would benefit from this type of therapy as well. Group therapy is a subtype of psychotherapy where multiple individuals and one or more licensed professionals who struggle with the same issue speak with one or more trained professionals simultaneously. Group counseling allows individuals who are struggling with mental health disorders to find others who have similar problems. Patients benefit from this type of therapy by listening to others and feeling less out of place. Counseling in this form is used for multiple cases such as Alcoholics Anonymous, grief counseling, physical illness counseling, mental disorder counseling, etc. An example of a group platform used for those struggling with a physical illness is groups formed for cancer patients. This allows them to find helpful coping mechanisms by listening to people who struggle with a similar issue. Family therapy is the next type of therapy, and it is the incorporation of including a loved one in your therapy sessions. This form of counseling can help students with adjusting to college life. Students could struggle with anxieties that accompany getting older and moving into a brand new environment. So licensed professionals use family therapy to help individuals struggling. Some individuals could be struggling with eating disorders or trauma disorders as well. The patient and their loved ones meet with a psychologist who specializes in working with families, and it is based on conversation and evidence-based treatment. Now we will compare the different types of therapy. I will be discussing the criteria for comparison. I went over various pros and cons while comparing these different methods and disorders. This report will directly target a collegiate audience who struggles with mental health disorders, and this will affect the criteria. Information provided in my report may be based on age, classification, such as freshman, sophomore, gender, and the specific mental health disorder that the individual may be suffering from. The comparisons will be simplified to ensure that the audience understands the recommendations for each mental health disorder. Now for my comparisons. Each recommendation, as I said before, is based on personal knowledge and research gathered. For family therapy, individuals with autism spectrum disorders and trauma and stressor-related disorders would benefit from this. For group therapy, it is beneficial for individuals with anxiety disorders and trauma and stressor-related disorders. And for psychotherapy, it is most beneficial for depressive disorders, anxiety disorders, and autism spectrum disorders. Now, onto my recommendations. As I said before, individuals with depressive disorders should attend one-on-one psychotherapy. Students with anxiety disorders should attend group therapy and psychotherapy. People struggling with autism should attend family and psychotherapy, and students struggling with trauma and stressor-related disorders should attend family and group therapy. This section covers each category of disorder and my reasoning behind each recommendation. For one-on-one treatment and my recommendation for that treatment type, is due to how it benefits students by helping them establish healthy coping mechanisms and helping them navigate through their college careers. For group therapy, it helps them with finding a support system for individuals who experience dealing with some type of disorder. And then for students and their families who benefit from family therapy, this is because families would understand the disorder thoroughly and will benefit the student by establishing a support system with their disorder as well. Here is my recommendations table as it summarizes my recommendations from my previous 2 slides. For depressive disorders, I recommend family therapy. For anxiety disorders, I recommend group and family therapy. For autism spectrum disorders, I recommend psychotherapy and family therapy. And for trauma and stressor related disorders, I recommend psychotherapy and group therapy. Now, to conclude my presentation, I have talked about 4 major categories of mental health disorders that could impact college students. The disorders explored were depressive disorders, anxiety disorders, autism spectrum disorders, and trauma and stressor related disorders. I also examined the different treatment methods available at many colleges and universities. Some of the treatment methods explored were psychotherapy, group therapy, and family therapy, and these options highlighted the potential benefits and the role they could help play in the student's ability to cope and potentially overcome their disorders to have a more rewarding and positive experience in college. I hope this serves as an informational resource to provide a deeper level of understanding of the different mental health disorders, as well as the treatments available to students who may be affected or afflicted with these disorders. I hope it brings about the importance of awareness and support for college students who struggle daily with these conditions to show the real need for effective interventions and treatment to improve their overall mental well-being. It is with hope that from this research, more contributions and light will be shed on the impacts and approach to mental health in both academic and broader life contexts so that students can start their journey into adulthood in a better state of mental health. Here are the references for all of the information that is provided in this presentation. And thank you so much for watching my presentation. Thank you for staying for a very long presentation, and I hope you have a wonderful day.